I'm gonna start by the beginning. So actually I met my business partner about 35 years ago. We were 10. I told him I wanted to live forever, and he replied he'd rather replace humankind by robots. So 15 years after, I got my PhD in the field of aging genetics, and I had some longevity targets in mind, but I was very depressed about the cost and the time that it takes to produce a drug. So I started to focus on cheminformatics. And there I quickly realized that it was mostly chemists trying to do mathematics. So I kind of called my old friend and I convinced him, he was back in the time professor in quantum information. I convinced him to retire and to join me to do Cortex. So what we have done, we started to gather most of the publicly available information about compounds and their properties. So we have about 750 million data points. The data is under the format, we have a molecule and we have a number. So the number can be like either a binary output, like active, inactive, or a dose response curve. It can be activation of a target, inhibition of a pathway, number of cells that die. Then we build some neural net with the modern machine learning approach. I won't go too much into details, but there are graph neural nets. We believe that with language model, you cannot understand chirality, like the difference between the right and the left hand. And another thing is that we're predicting everything at the same time. So that means that instead of just looking at one target, let's say, have the neural network made correlations between the compounds and the measured property, and then plugging the 20% remaining compounds, and then compare the predictions to what was actually measured. We do that for all the properties at the same time, which is about 5,000. And that enabled us to be as good as the experiments that we learned from when we saw that some compounds were tested multiple times for the same property. But that sounded a little bit like science fiction. People would say maybe we lie, maybe there is a leak between the training and the testing set. So actually we had to do some proof of concept. It was during COVID, so we had data about SARS-CoV-2 infected cells. But that was not enough. And since we predict everything at the same time, we realized that we could also take advantage of direct inhibition of viral protein or inhibition of cell proteins that are being hacked by the virus. So we also predict fluorescence, toxicity, and to make the story short, we had a deal with Aarhus University, and you might smile at it, but they could test only 6 compounds for free. And the good news is that 5 out of the 6 compounds worked. And 2 of them, we patented them, and they work before and after infection on human lung cell 3D cultures. We've done something similar with Stanford University. We also have 2 compounds with them. Then we had to look into that accuracy of our predictions. So we had a little project with the Victorian Center for Functional Genomics. There they gave us 80% of a non-public data set, and we actually were testing on the 20% remaining, and our predictions were as good as the experimental reproducibility. So our error rate was the same as the error rate of the experiment itself. Then we did a last proof of concept, more little bit to show that we could offer a virtual high throughput screening service. So there we worked with Sintef, a Norwegian company. We had a deal with them. The idea was to send them our top 10% predictions. So we found a library where there would be the largest number of predicted active for GP41 HIV1 inhibitors. We predicted there would be 22 active. There were 22 active. In our top 10%, we had 21 out of the 22 active, and 2 active in our top 3. And the probability you get there by luck is 1 out of a billion. So it looks like it's working. Then I had multiple conversations with chemists, and people want new molecules, and we had to find a way to see that our neural nets are good at generalizing. And interestingly, we realized that the predicted compounds that we have, they are actually closer to the closest inactive compounds than the closest active compound. So it's kind of a way of showing that. Here we do it with the Tanimoto similarity Morgan fingerprints, but we have other tricks with our own neural fingerprints. So that brings us to the business. Typically in the pharma industry, you would have a high throughput screening for about 500,000 compounds that would cost anywhere around $500,000 to $1 million. And actually what we can propose is to test 10 times less, but to screen 23 to 46 times more because we have aggregated all the publicly available libraries. And there, according to the calculations that were working for the HIV experiment, we would get about 5 times more hits, and it's cost effective at a ratio 20 times more. So we can predict solubility, permeability, log-P, actually everything that is being measured in the preclinical in vitro tests, so cytochrome inhibition and so on, with quite good accuracy. And we can generate some reports if we receive compound SMILE, but that's something that we can do actually in parallel. So not only we will look at activation of the target, but we will also discriminate parallelly the toxicity and choose like specific pharmacological property. So another thing that was interesting is that we want to make sure that we can screen lots of compounds, that we can get new compounds, and that we can get different types of compounds. So our system can screen about 1 billion compounds per day per GPU. So any physical library, we can do it. But then we wanted to explore this other virtual library that goes up to trillions of compounds. So there we made a little trick. We could call it generative AI, but it's guided actually by AI. So it's an evolutionary system that's guided by drug target activity prediction. And so we were good at exploring like uncharted chemical spaces. And then since we want to be able to benefit immediately, because we could squeeze the preclinical phase in very few months, but then it takes time for the clinical stuff. So we have basically fractioned everything into like what's FDA natural that we can put in pills probably like next year, which is FDA drugs, which is natural drug-like, which is natural food-like, which is like drug-like compounds that all the pharma companies or biotech would order for screening, and all these virtual libraries. So basically, we can offer like a service of virtual high-throughput screening, virtual ADMET-tox, virtual off-target, and we can also generate hit analogs that could be verified in vitro, but also in silico without having to synthesize them. So there is a lot of time that's like gained there, and each service is about 10 times cheaper than the physical experiment. It's as accurate. But then if we parallelize everything, we can go to something that's around 100 times cheaper and 10 times faster. So the idea is that I'm still on my mission to live forever. So actually, we do our own in-house pipeline of compounds. So a few weeks ago, it was quite an interesting experiment that we have done. We screened a library of 23 million compounds. And our 2 first compounds out of 10, the 2 out of 2 were tested, and 2 out of 2 worked. It was for NRF2 activation. So it's a mega regulator of oxidative stress enzymes such as superoxide dismutase, catalase, and glutathione peroxidase. And actually, we have other. The idea about this, it's just a little parenthesis that helps me sleep better at night, because the first proof of concept was about repurposing. The second one, it was a diversity library. But these 23 million compounds, they are not representative from our training set. So that means that we can really go and predict compounds that are very different from what we are training from. So we have several projects that we have launched. Usually we have some kind of deal where we do the in vitro and they do the in silico. So Brian Kennedy owes me some mTOR inhibitor testing. I have a project with Paul Robbins for Senolytics. I do DNA repair stuff with the University of Vienna, and there are a few CROs that are involved on some oncology and Alzheimer projects. The idea is that I have these new longevity targets in mind too, and if we don't have data, our assistant can do nothing. So we needed to find a way to do something without data. So we try to approach ducking in a completely different manner. And then instead of learning from crystallographic data, which is not suitable for deep learning, we learn from simulation. And we use deep learning to kind of squeeze that information, like you would compress a picture with a deep learning algorithm. And so far, it's already 1,000 times, it's a prototype. So this one, we don't sell it as a service, but it's already 1,000 times faster and is as bad as the other ducking systems, but we start being involved in R&D project, but not service. By the end of the year, we should have a ducking system that outperforms what's on the market. So actually, to make a quick summary, we have that new technology that can predict molecule properties. It's therapeutic field agnostic. We offer it as a service. But since we are on the mission like to reach this velocity escape thing, we basically are focusing on collaborations where people are trying to discover compounds in longevity. And so I'm happy to basically collaborate with anyone who's in small molecules in the preclinical area. So if you guys see me out there, you can grab a Guinness and we can talk about how improve and accelerate your discovery projects. So thank you.